Good afternoon, everyone. I am Liz Charlotte, Director of Communications at the Mississippi State Department of Health. I'm sorry I'm coming to you faceless today. Joining us today is State Health Officer Dr. Thomas Dobbs, State Epidemiologist Dr. Paul Byers, and Senior Deputy and Director of Health Protection, Mr. Jim Craig. So we have a variety of topics to talk about. A lot is going on. So what we're going to do is present what we want you to hear, and then I also incorporated a lot of your questions that have come up during the week. So I want to start out with some good news regarding COVID outreach. Dr. Dobbs, would you start us out on a good note?
Yes, thanks, Liz, and thanks everybody for being here. We're really glad to be seeing the benefits of the immunization campaign and where we are with the COVID pandemic in the sense that we have declining case numbers, declining deaths, although it's kind of flattened out, and hospitalizations. That's very beneficial. But we still have people who are getting sick and dying, and so we'll talk about that in a second. We also have some other things that we've done really well with. We've done a good job, and I'd like to really give a shout out to our health equity team and our partners in health equity community for really achieving a remarkable, near parity for our African American constituents. We have 36% of our vaccine going to African Americans in total, not just week, but total. So I think that really reflects the success of the efforts that we've all made together. But we are seeing some complacency, and we're seeing folks think that this is over. It's good that the cases are low, but we have a lot of challenges, and we will continue to see deaths, and we will continue to see cases and outbreaks. So if you haven't gotten vaccinated yet, please go ahead. We know that for people 65 and older, we've done a pretty good job. 75% plus of everybody in Mississippi 65 and older has been vaccinated, which is fantastic. But if we look at our lower age groups, we do see a lesser percentage of folks vaccinated, and we can see from our hospitalization trends in people in their 40s, that accounted for 3% of hospitalizations back in January and accounts for 12% of hospitalizations now. So we know the vaccines work. We know that people are vulnerable even if they don't think they are. So please get vaccinated. I do want to implore employers to consider celebrating and supporting your employees to get vaccinated, whether that's letting them take a day off of work or giving them, some recognition, maybe a little incentive or reward, maybe, more time off to recognize what they've done to protect not only themselves and their family, but also your workplace, so that your coworkers are going to be safe, and also you can go about your normal business. So please consider that if you're a Mississippi employer. The only last thing I'm going to touch on is certainly we know that CDC is looking closely at potential myositis that may be associated with the mRNA vaccines. They have seen a very small number of these. It looks like it might be after the second shot, maybe in the range of 16 per million. So again, extremely rare. It does appear that it's relatively mild, and people respond and recover very quickly. We don't know for sure actually whether how much this might be exposed, associated with the vaccine, or that it's because of COVID or other things in the environment. We do know that before the vaccine was here, we saw a marked increase in myositis from the virus. The virus is going to cause myositis at a far higher rate than even the theoretical concerns about the vaccine. We know that people, even now, we know that the chances of getting COVID are really substantial if you haven't been vaccinated going forward. So please make the choice to get the vaccine and don't get COVID, because the negative outcomes for COVID are severe. We know that there can be long-term consequences with long COVID. And a recent article today showed that even kids, up to 20% of kids, can actually have protracted symptoms from COVID. So please protect yourself, and also make sure your kids are protected. And I'll kick it back to you, Liz.
Thank you so much, Dr. Dobbs. And we do have a lot to be proud of, but we do have a way to go. So at this time, I want to get some epi information out to you all. So State Epidemiologist, Dr. Paul Byers, can you give us an update on numbers and anything else you want to cover?
Absolutely, Liz. And if y'all are okay, I'm gonna share a couple of slides, if that's all right with you. And these are slides certainly that everybody is familiar with now. We've looked at these trends over time for a number of weeks and a number of months. And again, this is an illustration of our cases as they occur over time, since really the beginning of the pandemic, when we identified our first case back in March of 2020. And as we've looked at, and these are the cases as they actually occur, either the date of their onset of illness or the date of their test if they have no symptoms, you can see that we've continued to have declines after our very large surge of cases over the holidays. And, you know, we're very pleased to see those trends continue downward in the number of cases, but we're also very pleased to see our number of hospitalizations for individuals with confirmed COVID continue to decline, as well as the number of individuals who have COVID and are hospitalized who've required ICU care or have required ventilator care. And this is data that is on our website. And I encourage, and I know that everybody goes and looks at this data, and it is a good resource for us. And so we do continue to see these declines. We think in large part it is due to our vaccination efforts, as Dr. Dobbs indicated, especially in those individuals 65 and older. We've had a good amount of success in vaccinating them, with over 75% of our individuals in that age group who've received at least one dose, and over 65% who have been fully vaccinated. And I think that that's reflective when we look at the individuals who are being hospitalized, and certainly the proportion of individuals who have been hospitalized who are between the ages of 18 and 40 has grown over time, as the proportion or percentage of individuals who've been hospitalized who are over the age of 65 has been reduced over time since we began our vaccination efforts back in December. Not only do we see that with hospitalizations, but we also see it with deaths. And when we look at our deaths over time, certainly we are still having deaths, and we're still having deaths in long-term care facilities. It's not at the proportion that we saw early on. As you all remember, when we were very early in the pandemic, and even through the first several months of the pandemic, we saw a very high proportion of our deaths among long-term care residents. Now, we still have outbreaks in long-term care settings. We currently have 18 outbreaks that are active and ongoing in long-term care settings, and 12 of those are in nursing homes. And many of the times, the source of the outbreak in those settings are among unvaccinated employees. So while we've had some great success in the vaccination efforts in our vulnerable groups, and that includes individuals who are residents of long-term care facilities, we still are seeing some gaps in the vaccination rates among our long-term care staff and employees. And we're going to continue to work on that. But I encourage you, if you work in one of those settings and you have not been vaccinated yet, please get vaccinated. This is the best way to protect that vulnerable population in those settings. If we look at where we are, just as a quick illustration and quick snapshot, just to kind of give you a better idea of where we're trending down with our cases. If you look at the 2-week time frame from May 13th through May 26th, we reported over 2,200 cases that occurred. But if you look at the most recent 2-week time frame from May 27th through just a couple of days ago on June 9th, you can see that almost dropped by almost half, about 1,200 cases reported. And we continue to see those declines. And if you look at deaths, we see the same general pattern. We are continuing to decline in deaths. But unfortunately, when we look at our deaths, we are still seeing a number of deaths in individuals 50 and older. Now, this is where we've had our greatest success with vaccination, but that's still where we're seeing a lot of deaths. And regrettably, in more than 90% of those cases, the deaths are occurring in unvaccinated individuals. And so we really need to continue to not only work with the vulnerable population to get them vaccinated, but also with the individuals who work in those settings. Variants, and we do monitor variants, and you know that we've had a number of cases of variant strains identified in Mississippi. Certainly, the UK variant or the B117 variant has been identified as likely the predominant strain that we're seeing in the United States. And certainly, when we do our surveillance for variant strains, we have seen that of those that we identify a variant strain in, the vast majority are the UK variant. And remember the concerns about the variants. And one of the reasons that we do surveillance for variant strains is because in some cases, these variant strains may be more highly transmissible or more infectious. In some cases, there may be reduced effectiveness of the vaccine. And in some cases, there may be reduced effectiveness for certain treatments, like the monoclonal antibodies. Now, to date, what we've seen is that the vaccine has still been effective against the variant strains that we've identified and are circulating in Mississippi and in the United States. This is good news, and this is encouraging, and this is why we still want everybody to get vaccinated. But if you've been watching recently, you know that not only have we identified some UK variant strains, we've also identified some South African variant strains, or what is now classified as by the World Health Organization, the variant beta strain. And this is a highly infectious strain. We have seen this South African variant identified in a couple of nursing home outbreaks that we had. We did some enhanced surveillance around those nursing home outbreaks that we identified. And the good news is we have not seen significant community spread of this variant. That doesn't mean that we're not going to pick up additional cases, but we have not seen that spread to date. Now, we have seen some of the very transmissible Indian variant. And previously, we had 5 of those cases identified in Mississippi in a number of central Mississippi counties. Late yesterday afternoon, we had received some reports of some additional variant cases due to the Indian variant. Now, we still have some investigation ongoing to determine what's the source of those infections and what the linkage may be to previous cases. But I think it's a reminder that we're seeing more Indian or variants in Mississippi now and in the U.S. And that's one of the fastest growing variants, primarily due to how transmissible it is, but the vaccine is still effective against it. So I encourage everybody who's not gotten vaccinated yet, now's not the time to wait. We have this tool in front of us that can help us get to the next phase of reducing cases and deaths in Mississippi. We just need to pick up that tool and use it and get vaccinated. The last thing that I want to talk to you about are our efforts with school testing. And we've talked about this before, that we've received funding from CDC to enhance testing in K-12 settings of asymptomatic people primarily, to identify those individuals who may be infected and exclude them from school setting before transmission can occur or limit transmission. And so we are in phase 1 of this process now, and we've been able to roll this out to 12 schools and school districts throughout the state, and those are the blue counties. That's where we have school systems that are now participating in this COVID testing program, that we're working very closely with those schools. And the counties in yellow are those that we're in the process of onboarding schools in those counties. And so we're going to continue this throughout the summer. And this is a great opportunity for schools, and we're there to help them. We're providing the test, we're providing support, we're providing funding for the schools and the school systems to be able to test their teachers, test their students that are not vaccinated, identify them early and exclude them from the school setting before transmission can occur. This is just another tool for us to be able to continue in-person school. And we had very successful in-person school over the last year. I think our school districts had a lot of buy-in to those infection control measures that not only CDC, but the Department of Health recommended. This is just another tool to help bridge through the summer and into the beginning of the school year. And we're working on additional plans to provide more support for that. In addition to looking at efforts to combine school-based vaccination efforts along with the testing. So stay tuned. There'll be more coming down the line as we get closer to the 2021-2022 school session. But that was pretty much everything, and I'm gonna send it back to you, Liz, and thanks for the opportunity, everybody, as always, and we look forward to questions.
Thank you, Dr. Byers. So, Mr. Craig, what I want you to talk about I mean, really at this point, you can't say vaccines are not available. We've had a lot of unique opportunities. And while we've talked a lot about it, this is another opportunity to remind Mississippians of all the unique opportunities to get a vaccine, including the fact that we'll come to you or your business or your church. So would you be happy to talk about that?
I will, Liz. Thank you. And you're right. For a long time now, we've presented numerous opportunities to get tested, and not just the health department. There are a lot of partners and pharmacies, healthcare organizations, as well as hospitals and others that have participated in helping get COVID vaccine in the state. But today I wanted to really provide you with a number of updates on a lot of activities that are going on, especially with health and some of the health department activities. And just a reminder that the health department operates free vaccination sites and locations around the state. And those sites are there for anyone 12 years of age and older in most cases. A parent or guardian must accompany minors to their vaccination, and that, you know, we've moved away from requiring appointments. So no appointment is required, but optional appointments are available for quicker service by just going to the COVID vaccine schedule application at the UMC site. Also, just a reminder, when you do arrive, expect the vaccination and the paperwork and the process in the beginning to last about 10 minutes. And then we have about a 15-minute observation period so that we can make sure that there are no reactions to the vaccine, and then we can get you on your way. So I'd like to just share a few slides with you to talk about some information and make sure everybody can see that. The map that you see here, and let me just start by saying this is the health department and the Mississippi National Guard working in tandem for a lot of these vaccination opportunities. I want to thank our public health teams and our friends, the young men and women at the Mississippi National Guard, for all their efforts in making sure that we get COVID vaccine available around the state of Mississippi. As you can see from this map, you know, we do these, what we are terming pop-up sites, where we'll go into a community, into a county, and sometimes those counties we go town by town, providing vaccination opportunities closer to where people live, work, and play. So the ones that you see in pink are some of the ones we just recently completed, are the salmon color. Those that you see in green are either first or second dose pop-up locations. This program has been very, very successful so far. And it looks like another 24 counties have now expressed an interest in us coming to their counties and providing some, again, vaccination closer to where people are live, work, and play. For updates on where our pop-up locations are, I put the link here at the bottom of this slide. And this is a part of our health department website on the vaccination page under pop-ups, where you will see these listed. So just a little update of where we are with some of these pop-ups. This week, we were in Wilkinson County. And in Wilkinson County, we were there Wednesday and Thursday of this week. And of course, there again today through noon. But we'll be back at the Wilkinson County Emergency Management Office in Woodville, Mississippi, tomorrow at 9 a.m. from noon. Again, no appointments are needed for any of these pop-up sites. They can sign up, show up, make an appointment to be sure there's vaccine there for them, or they can just call our hotline and let folks know that they're coming, and we'll make sure that we have the vaccine ready for them. Also in Sharkey County, we were there Wednesday, Thursday, and again today. We'll be there tomorrow as well from 9 to noon at the Rolling Fork Civic Center in Rolling Fork, Mississippi, right there on Highway 61. In addition, next week we'll be in Leake County, Wednesday, June 16th at the Walnut Grove Public Library. We'll also be there on Thursday, both days from 9 to 3. And on Friday, June 18th and Saturday, June 19th at McMillan Park Community Center in Carthage, Mississippi. So we look forward to coming and visit in the Leake County community. Down in Jefferson Davis County, we'll also be there Wednesday the 23rd and Thursday the 24th from 9 to 3 at the John H. Thompson Sports Complex on Highway 42 in Bassville, and also Friday, June 25th and Saturday, June 26th from 9 to noon at the Ezra Garner Memorial Market Building on Airport Road there in Prentiss, Mississippi. We'll also be in Claiborne County, Tuesday, June 15th at the County Safe Room from 9 to noon, Wednesday, June 16th at the Pattison Fire Department from 9 to noon, and Monday, June 14th, as well as Saturday, June 19th at the Claiborne County Emergency Management Auditorium in Port Gibson. Also be in Issaquena County at the Myersville Multipurpose Building on Friday, June 25th and Saturday, June 26th. And in Jefferson County, we'll be at the Jefferson County High School, Friday, June 25th and Saturday, June 26th. Just a reminder that for all of our pop-up locations, anyone 12 years and older is eligible for vaccination at a pop-up because we do use the Pfizer vaccine, the 2-dose vaccine. We also will have Johnson & Johnson single-dose vaccine for those 18 and over available at all of these pop-up locations. Dr. Dobbs acknowledged the health equity team and the efforts of the health equity team, and they have been just fantastic, event-driven for the most part, and a lot of partnership opportunities, as well as using Mississippi National Guard and public health teams to assist with part of their missions. The ones I've listed here are ones that the Health Department and the Mississippi National Guard will be participating in as well. In Olive Branch, the New Fellowship Christian Church on Friday, June 18th from 10 to 2. Also at Clark County at their multipurpose building on Monday, June 14th. At the Lamar County Community Shelter on Wednesday, June 16th. And the Hattiesburg House of Blessings Community Development Center on Saturday, June the 26th. As Liz mentioned, we not only have the facilities where people can come and be vaccinated and the partners to assist us with that, but we also are reaching out to the homebound. When we do pop-ups, one of the things we ask the local churches as well as local leaders is to try to identify those that are homebound ready for vaccination so that while we're in the town, we can go out and make sure that the homebound are vaccinated as well. But whether you're in a pop-up location or not, if you're homebound and need assistance in getting COVID vaccination, just need to send an email to COVID homebound at msdh.ms.gov or by calling our COVID hotline 7 days a week between the hours of 7 a.m. and 7 p.m. And we will get someone set up to assist with getting you vaccinated. With the temperatures, we have now moved away from our drive-through locations at our state sites, and they are now come inside for state walk-in vaccination locations. And you can see here the same 19 sites that we were at before for state drive-through have now moved into these particular locations that you see depicted on the slide here. Also note in number 5 and number 14, which are both Washington and Adams County, those are sites that we use the Moderna vaccine. As you might remember, Moderna is for 18 years and older. So those particular locations, the 12 through 17 vaccine is not necessarily available. When we look at our county drive-through vaccination sites, we have 2 of them still functioning. One in Warren County at the Vicksburg Mall. It's operating on Wednesdays, and next Wednesday will be the last day of operation for our Warren County partners. And then in Montgomery County, our partners there are working on Tuesdays at their Coliseum, and they will be there through June the 29th. So please, if you're in those areas around Winona or Vicksburg, make those opportunities your opportunity. So something new that's coming up is we're also moving into our county health departments, making sure that we have vaccination sites in those. And here's a few of the counties that we're opening up this week and next week for vaccination. As you can see, those that are listed in yellow are Adams and Washington. As I said just a little bit ago, those are our Moderna sites. All the other sites that you see listed on this page are Pfizer, so they are good for vaccinating from the ages of 12 through 17. You can sign up at covidvaccine.umc.edu for an appointment in any of these county health departments, the same location that you would sign up for a pop-up or state site, or by calling the COVID hotline. You can see the days of operation, the hours of operation. They're not available all day, but we will have special clinics so that we can get people in and out timely on these particular days and times for COVID vaccine. Also, just to give you a situation update on testing, we have secured a contractor to assist with testing around the state of Mississippi. For those particular counties where we have identified partners, and really in most all of Mississippi now, free COVID testing is available. Some of it is through our partners, and a list can be found of those partners on our website at healthyms.com under COVID testing. For counties where there's little or no free testing, we have engaged a contractor to assist us in providing free testing in the parking lots at select county health departments. As you can see the map here, these are the areas where we will be providing that testing in the parking lots. Here's a list. There's also a list on our health department website of what parking lots these tests will be available in. And as you can see here, there are also days and times. Most of these are not full day testing. Some of them are, but most of them are not full day testing. So you'll need to look at the different day and time as you look for testing opportunities through the state. As also Liz said, you know, we're doing our best to try to continue to increase vaccination rates in the state of Mississippi. And so it's much bigger than our partners in the health department. It's physicians, it's a whole lot of folks, including people who are in organizations, cities, groups, or individuals. If you're interested in holding COVID-19 vaccination event in your community, particularly in rural or minority communities with less access to COVID-19 vaccine, please call our hotline at 877-978-6453 or email us at vaccineevent@msdh.ms.gov so that we can try to see if we can get vaccine closer to your location as well. And Liz, that's my update for today. And I'll turn it back over to you.
Well, that was a great update. A lot of clinics out there and available vaccine sites and testing sites. So before we go to the questions, this week, a lot of you asked about vaccine wastage, and I am not sure that the understanding went out of what is really going on. We never received these vaccines and sent them back, so they were not rejected as reported. Dr. Dobbs, would you talk a little bit about that?
Yeah, absolutely. So just so you know, how do we get vaccines? We kind of run almost a real-time inventory. So based on demand, we pull it down from our federal allocation. So the 870,000 doses that has been, shared in the media, those are the doses that could have been available to us if we needed them, right? So those aren't doses that we had and we sent anywhere. Those are just underutilized doses. So, and of course, early on, we recognized that other states were in greater need. And so I was happy to work with Rhode Island and Maine to make sure that they had those vaccines available. If Mississippi people don't understand how important it is to keep them alive, we want to protect other Americans. And so I was glad we were able to sort of get ahead of the federal program to help our fellow Americans in the Northeast. There's been a very small number of wasted doses, but and I think Liz has shared that before with some different folks. Overall, it looks like altogether, MSDH has wasted maybe 1,300 doses, right? But when you consider that each vial contains either 6 or 11 doses, or now either 16 or 6 doses, and if you don't have that many people there, you just can't use them all because they have a very short shelf life after you open them up. But right now, that's not the concern, right? We don't want vaccines sitting in a fridge because someone's afraid they might waste a dose or two. A vaccine in an arm is better than 6 vaccines in a refrigerator, right? So that's not going to be really something that we should see as an impediment. If we have someone who wants a shot, we need to get it to them, whatever we can do under every circumstance.
Thank you, Dr. Dobbs. And also, the CDC has recommended this course of action. They want us to put shots in arms regardless of doses that may have expired due to refrigeration sensitivity or the way it's packaged. So thank you for going over that. We are going to go to the questions, and first is Keisha Rowe from the Clarion Ledger. Her first question is, national news organizations and polls have noted party affiliation has the most to do with who is and is not getting vaccinated at this point. They show Republicans tend to be less fully vaccinated and more hesitant toward doing so. How does that apply to Mississippians as it is a red state with more red counties with low vaccination rates compared to same size blue counties? And why do you believe this is? Dr. Dobbs, we of course did our own survey as well, and you might want to talk about that as you answer Keisha's question.
Yeah, no, thank you for the question. So we did our own survey, which didn't show those stark of a differences, but the methodology was different and the categorization was more broad. So it certainly explains some of the difference. But it was a convenient sample, right? So it's if people who volunteered to take it wasn't randomized. So there will be some difference in methodology. But there are some important things that we identified that are worth paying attention to. And I think it speaks to a lot of our health challenges beyond COVID, right? We saw that people who had lower levels of education, we saw that people who had lower levels of income, and we know that people who are more rural face health equity issues in general, and that was borne out in our own findings. So there are some intrinsic challenges we know that exist out there anyway. The other piece of that is that we do know there's opportunities from our own evaluations. And the most important thing for folks, we've seen this not only in the data, but also anecdotally, is that one-on-one conversation with your trusted physician, with your doctor in your clinic, with your primary care provider. That's where we are. If you're the doc, if you're the NP, if you're the PA, you need to figure out who of your patients have been vaccinated, who haven't, and make sure that they understand the real implications of that decision to not get vaccinated. And if you're a patient and you're unsure and you just want to ask questions, please get with your doctor. It's important for you to understand what's going on. There's so much crazy nonsense in social media and in the world out there. It's confusing for people. If people don't feel comfortable, we want them to talk to their doc to get the best information on what to do.
Thank you, Dr. Dobbs. And I think Keisha is also asking, strategy-wise, if political party affiliation in Mississippi is tied to vaccination rates, what needs to be done to increase the rates among those individuals?
Yeah, I'm sure there's a lot that needs to happen, but the same thing that happens with anything that you're successful, it's a partnership. And I will say that we did tried to do an outreach in a town hall for leaders of white churches, or predominantly white churches, and it was a very tepid response. We need our leaders in every community to step forward and make the bold stance of letting their congregants, letting their constituents know how important it is. Obviously, if you look at what Mr. Craig presented, we are going all out to make sure that vaccines are available to everybody with the minimum barriers possible, right? We're going to do everything we can, but we can't do everything by ourselves. This is a community effort. And I just call on every member of the community who recognizes the importance of protecting one another to step forward and help your community, your partners, the people that are who you influence to understand the importance of getting protected with the vaccine.
Thank you, Dr. Dobbs. Let's see, Andy is asking, can someone address reports of heart issues in young people who have received the vaccine? Dr. Dobbs, you did go over that and explain that those incidents aren't very high, that there were incidents with the second shot, 16 per million nationally, is that correct?
That's what they've reported so far. Now keep in mind, they're still looking at this because there is an underlying average occurrence of myocarditis for people as a random background, right? So some of that's not going to be related, and so the data is not borne out. But there is some suggestion that might be there, and I don't know if Dr. Byers wants to add anything what we're seeing. The only thing I'll add is it does seem like the most folks seem like they recover without incident.
Yeah, I think that was going to be the biggest point that I was going to make, Dr. Dobbs, is that for most individuals in which this has been identified in post-vaccination nationally, more than 80% that they've been able to follow up with have recovered completely with no long-term problems, and the vast majority of them, it's been mild in these younger age groups of older teens and younger adults. And certainly that's one of the things that we're watching in Mississippi. It's potentially mostly been seen after the mRNA vaccines, after the second dose of those vaccines, the Pfizer and the Moderna. And we do have a system that we've talked about previously, the Vaccine Adverse Events Reporting System, that we monitor to look for cases of myocarditis or pericarditis that may be reported post-vaccination, and investigate those further to see if they do fit what's being seen nationally. Again, this has been a very small majority when you think about the number of vaccines that have been administered in both Mississippi and nationally. These are very small numbers that we're talking about for individuals in which they've identified potential pericarditis or myocarditis post-vaccination. But it does bear watching, and that's one of the things that we're doing.
Thank you to both of you. Jim Craig, this is going to come to you from Kobe Vance with MPB News. Last week, y'all mentioned that vaccine providers can now order as little as 6 doses of the vaccine. After at least 1 week of using this system, how has that changed the state's vaccine distribution process? Has it made it easier to get vaccines into more rural communities?
Yeah, Liz, thank you. And Kobe, thank you for that question. It has. That's the simple answer, is that, you know, one of the barriers that was identified early on with these multi-dose vials in small clinic operations and small clinical practices. So having these vaccine depots now available in various areas of the state is now making it a lot easier for those facilities to be able to get vaccine enough for the week and be able to administer it where many people want to receive vaccine, and that's in their physician's office.
Thank you, Mr. Craig. CJ, I think we have discussed this. CJ, I think Dr. Dobbs just explained it, but I'll go ahead and ask it. I want to ask about the more than 870,000 doses that are going to other states or transferred back to the federal pool. When someone sees that number, it is fairly alarming. Can you put that in perspective for us in terms of continued efforts to get shots in arms across Mississippi? Dr. Dobbs, can you take that?
Yeah, just kind of reiterate, those weren't doses that were transferred back. They were never sent here. Those were just within our potential allocation. So we're pulling down as much as people order to be given. I think that the flip side of this is, which is really remarkable, is just to say, you know, this isn't a Mississippi issue. I think that the federal government and our partners who've developed these vaccines have done a fantastic job making these available, and it is reflected by the surplus. So I think, you know, we didn't know that both the Moderna and the Pfizer would be so remarkably effective, and then that the Johnson & Johnson would show its utility. So I think it's really more of a demonstration of abundance, but there's vaccine out there, and we're going to continue to make it available to everyone in every corner of the state as much as we can.
Thank you, Dr. Dobbs. I guess everyone needs to understand this, and the fact is we are allocated, just like every other state, a certain number of doses. We have the option then of ordering those doses. We would order them if we did not have ample doses here. So when they are not ordered, they are either sent to other states by the CDC, or they're put back in the federal pool for those who need them. Keisha Rowe, let's see, she says, Dr. Dobbs, thank you for those answers. I have a separate question regarding what Dr. Byers was mentioning regarding school testing. The map you showed was quick, but it seemed like school districts in the Jackson Metro and the DeSoto County School District have not yet joined the testing program. Have they expressed interest in joining this program?
I think the short answer is that we've had lots of school systems that have expressed a lot of interest and are in various stages of working on this. And certainly, school districts, as we've rolled this out, there's a lot to put in place for a school district, and it depends on where they are in their summer program and the best way to utilize it. I think the biggest key is going to be where we are in the fall. And we're in phase one now. This is the very early phase of these testing initiatives in school. School is out. And by and large, there are some schools that are looking at trying to do this over the summer for both their students and teachers who are participating in summer programs, but also individuals who are participating in sports and other school-sponsored activities over the summer. But every school district and school is sort of in a different place right now, and they have to work within their framework of school boards and get appropriate approval. And right now, the school-based testing that we have is in many ways largely dependent upon the school and what their capacity is to be able to conduct this on-site testing. As we move through the summer, one of the goals that we have is to be able to support these school testings through vendors who can go directly on site at the schools and take much of the burden off of the schools and come in and make sure that that testing is available for both the students and the teachers in that setting. And so I think as we move through, because we're still very early in this process, we're going to see more and more schools that are interested and are onboarding and are joining the process. And one of the things that our team is doing here in EPI is they are having each week discussions with all of the schools in the state that want to join and participate, to answer questions, to talk to them about how they can do this, to talk to them about what's the best way that we can do it. And we hear from school districts throughout the state at various levels of interest. And so I don't think that it's a question that there's not any schools that are not interested in this program. I think it's a matter of where they are in their trajectory of trying to do their planning at this point.
Okay, thank you, Dr. Byers. CJ, again, Governor Tate Reeves said on CNN last week that our last place ranking in percentage of residents fully vaccinated didn't take into account those who've had natural immunity from having contracted the disease, the virus, and commented that far more than MSDH recorded are likely to have had the virus. And we've talked about that seroprevalence. So maybe you could talk a little bit about that. I guess, Dr. Byers, maybe you would be the person to talk about that.
Well, I can certainly talk a little bit about it, and thank you for the question. And certainly I'll defer to Dr. Dobbs as well. But when you look at seroprevalence, that's actually the percent of the population who may have actually been infected previously with COVID or with any infectious disease. And you can look at that and estimate what your prevalence of individuals who've had previous infection based on doing an antibody test. And if you look at our seroprevalence in Mississippi, the most current is about 28%. And that gives you an estimate of over 800,000 potential cases in Mississippi. And certainly we've reported out a bit over 300,000 cases. And so, we knew that did not represent the full extent of cases. We know that many people who are infected have no symptoms. Many people are infected who may have mild symptoms, may never go to the doctor or get tested. And so we knew that the 300,000 cases that we reported out did not represent the full breadth of the number of cases that have occurred in Mississippi. Infection can give you some natural immunity. And we know that people, at least for a short time, several months, 3 months, probably a bit more than that, do have a reduced chance of becoming reinfected after they've been infected with COVID. I think the thing that we want everybody to understand is, yes, you can get some immunity from previous infection. And yes, that can protect you from becoming reinfected. But, and certainly that can have an impact on the transmission in Mississippi along with our vaccination rates. and you get a pool of people who are protected against infection. And that helps keep the transmission down and the rates low. But it's important that even if you've been infected, the best way to ensure immunity, the best way to ensure that you have long-term and full protection is to get vaccinated. It's not to rely solely on the fact that you were previously infected or you think you may have been infected. The best bet is still going to get vaccinated. And I'm going to let Dr. Dobbs sort of weigh in on that.
Yeah, no, I agree entirely. I mean, we certainly are getting some population benefit from our previous cases, but we paid for it. We paid for it with deaths. And if you compare us to states like Oregon and Vermont, if you look at their seroprevalence, I think Oregon's is around 8%. I think Vermont's around 3%. And their mortality figures reflect that low number of people who've had it before. So yes, do we have more immunity in our population from natural cases compared to some other states? We do. But the bad side of that is we lost a lot of Mississippians in the process.
Thank you, Dr. Dobbs. WXXV, when will in-school vaccination start? Will parents need to be present at school for their child to receive the vaccine? I think we're still in phase 1 of this and setting this program up, but Dr. Byers, do you know when the in-school vaccination opportunities will start?
Well, certainly we're in the beginning stages of this, and we do have a program now where providers throughout the state certainly have the opportunity to go to schools and to those summer programs and to vaccinate and work with the schools in the school district. And in some cases, I know that there are some providers who've talked about the potential for going into schools over the summer to help vaccinate some of those students and teachers while they're there. The reality is that students and teachers have the opportunity to get vaccinated now. They don't, although we want to make it convenient, they don't have to wait for a school-based clinic. As Mr. Craig outlined already, there are numerous opportunities for both teachers and students to get vaccinated. And just as a reminder, 12 years of age and older are the folks who are eligible for vaccination. And we encourage not to wait necessarily for a school-based clinic to come to you, although we're working on those, and that's going to be an important piece. But you don't have to wait for that. Take the opportunity to get your child vaccinated now. If you're a student or a teacher, get vaccinated now. Lots of opportunities to do it. And that's going to be the thing, I think, in the long run. And we talk about that, and people ask us a lot about what's it going to be like in school in the fall? Are there going to be masks? You know, is there going to be quarantine? Are we going to do contact tracing? Much of that is going to depend on how many folks we can get vaccinated now over the summer. And the more students, the more teachers who are eligible that we can get vaccinated, it's going to make in-person school even easier. Now, we've done school-based vaccination efforts for a lot of things. Many of you who are around during H1N1, remember that we had providers and the health department who went directly on site and vaccinated students and teachers against H1N1 back at the previous pandemic back in 2009 and 10. And so, you know, there are ways to do this. And the parent doesn't have to typically be present. We have a consent process that allows for parents to be able to consent for their child to get vaccinated. And, you know, we've done these before through the health department and we've got it down, but we also want to partner with folks to be able to do it. But I think, you know, just stay tuned. We're working on those processes now. And certainly by the time school starts in the fall, we hope to have those on the ground and running. Sorry, that was a long answer.
That's okay, Dr. Byers. Leah, I think I asked your first question, but perhaps not your second. If I'm mistaken, just send me a direct chat mail. Did I ask you, I'll go with Jim Craig, how many doses does the state have in its supply? At the rate vaccinations are going, will Mississippi be able to use all of that supply?
You know, as Dr. Dobbs alluded, it's a real-time, more or less a real-time inventory. So we predict out based on appointments what it looks like we'll need in vaccine, and then they make those orders, and a couple of days later we receive the vaccine to utilize. So the short and long of it is we have enough vaccine for Mississippians who want to be vaccinated that right now. So if you're waiting to be vaccinated, don't wait anymore. We have the vaccine for you. Just come on down to one of these locations or meet up with one of our partners, stop at a pharmacy that's providing vaccination, and go ahead and get vaccinated now.
Okay, and I guess I did skip Leah's first question. Despite a low vaccination rate compared to other states, cases and hospitalization rates haven't really materialized at high levels in Mississippi in recent months. Do you have any thoughts or theories on why that's the case and why Mississippi has been spared? Dr. Dobbs, would you take that?
I don't think we've been remotely spared. I think that we've suffered and lost a lot of loved ones. You know, if you did a, you know, sort of a back of the envelope calculation based on percentages and assumptions on natural immunity from infection, you know, the combined value puts us, you know, around 60-something% of people with some underlying immunity. So we're now sort of seeing that effect most likely because we have a combination of natural and vaccine-induced immunity. But I do want to get back to Dr. Byers' point is that the vaccination is still very important, even if you've had COVID. And we know that the immune response from the vaccine is robust, and it augments it if you've had the vaccine before, if you've had the virus before, but also it looks like the immunity from the vaccine is actually more potent than the post-infection immunity.
Okay, thank you, Dr. Dobbs. I'm going to go to CJ. CJ, we have done a massive amount of advertising. What we do when we do our ad campaigns, and we have done radio, TV, we've gone out to communities, we have done Zoom conferences with large numbers of groups, for example, educators and agricultural folks. We have reached out in any number of ways, and we don't just find radio and TV as the most effective way to advertise. So through this geo-targeting social media that we do, or the targeted outreach we did over Zoom, we can ask specific groups their specific questions. I sure wanted to get Deion Sanders, but hey, CJ, he wouldn't do it for me, and that's a darn shame. I was counting on him. I met him many years ago, and I really thought he'd do that for me, but he didn't. And we have done campaigns targeted to African Americans. We have done campaigns with African American leaders speaking to African Americans. We've done robust TV and ads with focus groups. We actually use focus groups to base our ads on those, and those ran statewide. And so you might not have seen it because you might not be the target. In fact, your age, you wouldn't be the target, but we have done numerous work, and I'm blessed to have several more dollars to continue our outreach about the pop-up sites and about our testing, and also about our telehealth prep, which we'd love for you guys to advertise for us as well. So look forward to all of that. And thank you for your question, CJ. Tyler Jones. Hi, hello. I'm Tyler B. Jones from the Commercial Dispatch. Hi, Tyler. Why can 12 to 17-year-olds only receive Pfizer? Well, that's a good question. Why can they only receive Pfizer and not J&J or Moderna? I'm going to ask the boss.
Yeah, so Pfizer is the only one approved for kids in the age group that we're looking at. So like every vaccine has to stand on its own merits, and every vaccine has to have data and be approved through the FDA process, and then also be evaluated through ACIP, the Advisory Committee on Immunization Practices. So right now it's just that the Pfizer vaccine is the only one that's approved for this age group. And I know for certain that Moderna is looking at getting that same authorization. I'm not so sure about Johnson & Johnson. Jim or Paul Gilman.
You know, I think you're correct. You know, there's an authorization issued by the FDA for the use of the vaccine, and it does specify age groups. And Moderna is looking to have their age group reviewed to the 12 and 17 as well. So maybe we'll hear a little bit more about that later. But right now, Pfizer is the only one that we're authorized to provide for 12 to 17-year-olds.
And just to add, I know that Pfizer is also looking at data and trials for lowering their age group even further to really start getting more of the younger kids, which is going to be important as we go forward.
Okay, Thanks, guys. My team that is looking out for me said, and I hate when I do this, y'all, but the writing is so tiny. Aaliyah Wright, State Line reporter, I thought I did your question as well. There have been efforts to increase vaccine access, which of course you heard about from Mr. Jim Craig, especially for those people in rural areas. What are ways to reach people who don't have primary care providers, who don't regularly visit doctors and healthcare professionals? Though Mississippi is making progress, vaccination uptake is still relatively, I think is still lower relatively than the other states. Does this keep you up at night? Yes, it keeps all of us up at night. What can be done to increase vaccine confidence? I think it's twofold issue. One might be confidence and one might be complacency. Dr. Byers, why don't you talk about the confidence, and Dr. Dobbs, you'll take the complacency.
You know, the vaccine confidence has been one of those things that we've talked about and we've struggled with. And the first thing that I would say is you know, if you don't have a healthcare provider, I would encourage everyone who right now is interested in getting vaccine to go to vaccines.gov, where you can find a provider in addition to all of the providers that and all the opportunities that Mr. Craig outlined that the health department is doing. There's a number of pharmacies throughout the state. There's physician offices. There's centers of excellence that all have vaccine, and you do not have to be their primary patient to be able to receive those. You can go to the CVS, you can go to the Walgreens, and you can get vaccinated today, right this minute. The confidence is one of those things that we've talked a lot about. I think that part of it has been that there's been a lot of misinformation about the vaccines and about this claim that they were rushed through the production process and rushed through the approval process. And although it was accelerated, no steps were skipped. This had full and complete phase 1 through phase 3 trials for all of these vaccines. They had full and complete review from FDA to receive this emergency use authorization. And I think the data has shown that these vaccines have been safe and effective and are really our best way to prevent infection. And as Dr. Dobbs always says, vaccine is the way to go, because if you don't get vaccinated, you're more than likely going to get COVID. And there is no time and answer when COVID is going to be the best option. You really run some risks. And even though we see a lot of individuals that have minimal symptoms, who don't require hospitalization, who don't have severe disease, we see hospitalizations and deaths that have occurred across all age groups. And so this really is not something that we want to defer to the disease instead of the vaccine. And I know that Dr. Dobbs has much more that he would like to say about this as well.
Dr. Dobbs, talk a little bit about the complacency issue. We talked about it, you know, certainly the number of cases and deaths may put some people at ease, but that's only because we've been doing vaccinations. So we don't want people to get complacent when they see these numbers. Would you talk about that?
Yeah, no, there's a couple things. I mean, first off is, you know, COVID is not gone. We're going to see deaths. We're going to see challenges. We're going to see variants emerge and grow. They're going to cause trouble for folks. But I would challenge all of us to look at this in the broader context of the Mississippi state of health. We have a very dysfunctional relationship with health. We don't seek health care unless we're sick. We don't have a high rate of people doing preventive measures. I think this isn't something that surprised us in the least based on our efforts with influenza, right? We do a pretty good job, and I think we've done a good job with COVID vaccine for our 65 and older, because once folks are at that age, they recognize the value of the regular follow-ups and the preventive services. But we have a real challenge and a real failure in health prevention in our state that's borne out by, you know, our high breast cancer mortality, you know, our cervical cancer. It goes well beyond COVID. And It's not a COVID thing. It's not a COVID vaccine. It's a Mississippi thing. And we need to think about it holistically so that Mississippians can benefit from the phenomenal and wonderful preventive opportunities that are out there for us to live healthy, productive lives.
Thank you to both of you. This is a good question. This comes from Andy, and she's asking, can you explain how a variant develops? And number two, with the emergence of variants, is there a possibility of another extreme outbreak as we saw with the original coronavirus outbreak? Good questions. Dr. Byers, why don't you start?
I certainly can. And so, viruses like a coronavirus, viruses like an influenza virus, they're being modified and changing and mutating all of the time. That's just part of the normal processes of these. And sometimes, if a mutation occurs, if something changes within the gene segment that allows that viral strain to have an advantage, like it's more infectious, more easily transmissible, the vaccine is not as effective against it, we can see that strain becomes more of a variant strain that leads to significant transmission and is recognized. But it's important to understand that if you look at the virus, it's changing all the time. It's modifying all the time. But one of the things that really leads to and enhances those changes is when you have a lot of people who are getting infected. That gives a lot more opportunity for that virus to propagate and mutate and change and become and emerge as a variant strain that has those qualities that can make it more infectious, lead to a more severe infection. We see the same thing with influenza. And so the best way to keep those variant strains from emerging, from developing, is when you keep the transmission low. And the best way to keep the transmission low is to follow the public health measures like we talked about for a long time. To get vaccinated. The less virus that's circulating, the less opportunity there is for a variant strain to emerge. And the second piece of that question is it possible that we'll see a variant that may lead to the level of transmission that we saw previously? Maybe, but I think that we do have to watch out for those variant strains, because it certainly is plausible that we will see a variant strain that emerges that becomes the predominant strain that potentially is more infectious. It's easier to catch. Potentially, we may have one that develops that the vaccines are not as effective against. And potentially, we may have one that develops that causes a more severe infection. But I think, those are the things that we need to watch for. And we're kind of in a honeymoon stage right now because our cases are low, but we've still got a lot of work to do. We can't rest on our laurels. We need to be getting vaccinated now. And I know that Dr. Dobbs has a lot more to say about that.
Dr. Dobbs?
Yeah, no, I agree exactly. I mean, the thing about coronaviruses is they are single-stranded RNA viruses, and they don't have the fidelity in reproduction that other organisms have. They don't have sort of as much error checking mechanisms within their reproductive cycle that prevents these random mutations. And so, the more, if you rolled 1,000 dice and they were all going to turn one, is going to be the bad mutation. Well, if you roll dice a few hundred times, you're not going to all hit ones on that many. But if you roll it 1 billion times, you're going to hit all ones every now and again.
Okay, thank you, Dr. Byers and Dr. Dobbs. Colby, this isn't about COVID, but I am more than pleased we don't have our HIV experts here, but we can talk to you a little bit about this. The Department of Health has announced several programs recently to combat the HIV epidemic in Mississippi. Could you discuss some of the new efforts and what other programs is the state considering in the future? And that was what I was just talking about when CJ was asking about vaccines. This is really an HIV issue, but I'm so excited that we do have telehealth available for PrEP. And so I would like, Dr. Byers, can you talk first about it?
Certainly, I can introduce it, and you know, Dr. Dobbs has been intimately involved in our efforts as well. And you know, the one of the big things that we're looking at, and it's a big opportunity, and we're providing these services now throughout the state, is teleprep. We do know that individuals who are partners of those individuals who are HIV or continuously exposed individuals with HIV have an opportunity to take the appropriate medications to prevent infection, and it's highly effective. And you know, in efforts to streamline this process, to make PrEP more available to individuals at higher risk for HIV infection throughout the state, one of the new tools that we're utilizing is teleprep, and this is an opportunity for an individual to work through our network of individuals who can sign them up for teleprep. You meet with a provider over the phone through a Zoom, and they get your information and prescribe you the medication. You can go to a county health department and you can get some blood work done, but you don't have to be in the same place as the provider. This removes one of those barriers to getting PrEP, and in the long run can really reduce the incidence of HIV in Mississippi. And I think this is one of the opportunities that's grown out of telehealth in general and our moves towards telehealth. But Dr. Dobbs, again, has been intimately involved in this and leading the charge for us.
Dr. Dobbs?
Yeah, no, I've been treating HIV since 1996, and something I've been doing for a long time. It's really remarkable what we can do. We just got to connect people with resources. We are doing teleprep, and I put the number in there for folks. And PrEP is basically, it's a pill a day that's 99% effective in preventing HIV from sexual transmission, and it's in the 70% for people who are at risk because of IV drug use. So we're going to make ourselves available. I'm looking forward to myself being able to do teleprep clinics. I'm going to set up my own availability for folks. So I'm looking forward to doing some more clinical work again. The other thing is, you know, there's all kind of neat stuff. So if you go to our Ending the HIV Epidemic plan on the MSTH website, you can see all the things that are in there. A lot of it's early diagnosis, linkage to care, PrEP, outbreak response, the things that we know that work. One other thing I think that I'd love for people to know is that if you are living with HIV and you don't have health insurance, we will pay your health insurance premiums, right? There are resources out there to help people to prevent contracting HIV, but if folks are living with it, to make sure they have adequate treatment. So if you're one of those folks, we can connect you with the resources that you need.
Thank you, Dr. Dobbs. Leah from AP, has Mississippi accepted new doses of vaccine from the federal government in the last few weeks? Now, Jim, Mr. Craig, would that be you or would that be Paul with immunizations?
Best I know, and Paul, you can correct me if I don't get this exactly right, but you know, with the decrease in demand for a lot of the vaccine, we do have ample vaccine in Mississippi for what we have scheduled for the next couple of weeks. So I don't think that we have drawn down any additional vaccine from the federal government over the last 2 weeks.
You're correct, and we do have plenty of vaccine in Mississippi. And gosh, guys, you all remember when we were in this early back in January and February, the issue was that we had people clamoring for vaccine, and we just didn't have the doses, and we were spreading them thin throughout the state. And we've got the doses now. We need the people to line back up and come get them again.
Okay, thanks, guys. Let's see. I'm going to do one sentence, the most important thing you want to get out at the end of this press conference today. Thomas, you went first in the beginning, so you can go first now.
Hey, yeah, so I just want to reiterate that COVID's still here, and sadly, we're going to lose more of our friends and family, but we have a fabulous way to prevent that. You're likely to get either vaccinated or get COVID, and under every scenario, the vaccine is the right pathway. Protect yourself, protect your family, protect your friends. It's time.
Thank you, Dr. Dobbs. Dr. Byers?
Well, how do you beat that? I mean, you know, he said where we all are, I think there's some other things that we want to watch and some other things that we want to look at. And I would challenge you and encourage you, if you're a healthcare provider, if you're working with the vulnerable population in the state and you have not yet gotten vaccinated, now's your opportunity. We want to continue to protect the people that we serve in the healthcare community. And I think we want to continue to move towards that. So I would encourage anybody who works in a setting where you are around vulnerable people, whether you're a healthcare provider or not, or if you live with somebody who is a vulnerable person, we are still seeing an impact on our older individuals. And so we want to get everybody vaccinated.
All right, Mr. Jim Craig.
Yeah, and just, we are still all in this together. And of course, the media has been great in trying to help get the message out, to get folks ready for vaccination, and now to hopefully get people vaccinated. We went over a lot of different opportunities that the health department has for vaccination, but remember those pharmacies, partners, community health centers, there's a lot of folks that are out there trying to help in the vaccination message. But let me also remind everyone, we have and we will continue to help anyone who would like to set up their own vaccination sites, including work sites. So if you know someone is looking to put together a vaccination site, please let us know. We're ready to go.
Yeah, and Dr. Dobbs will personally go to your home and give you a vaccine. Thank you. Thanks to all the reporters listening. On behalf of Dr. Dobbs, Dr. Paul Byers, and Mr. Jim Craig, I'm Liz Charlotte, thanking you for joining us. Have a great weekend.